Okay, everybody, welcome to part 8 of your pharmacology. We are done with the drugs. Yay. We got through the meat and potatoes. Now we just got to kind of clean up some other stuff, and then we'll be done with this lecture. Drug administration. We use what's called the 6 rights, and we call those 6 rights Dr. Pat's. That's your mnemonic. That's one of the first mnemonics you guys are going to be learning in this class. You'll learn real quick that EMS loves their mnemonics, that's for sure, okay? So Dr. Pat's, it's the right drug, it's the right route, it's the right patient, it's the right amount, it's the right time, and we're going to write scribe. Scribe means write it down, right? We're going to write it down, okay? This helps prevent medication errors, okay? Medication errors is a hot topic in the U.S. We, as medical professionals, from doctors all the way down to medical assistants or certified nursing assistants, right? Well, we suck at giving medications. We are one of the worst countries in the world for medication errors. We, for whatever reason, we are always constantly in a hurry. We don't like to do math. And unfortunately, our patients suffer the outcomes of this. There's no need for this. Guys, I'm going to tell you something. You guys are going to hear this numerous times come out of my mouth. In EMS, guys, this is not your emergency. Okay? This is your patient's emergency. It's not your emergency. Calm down, take a deep breath, fall back on your training, and never stop thinking. Okay? Never stop thinking. You guys are going to be put in some serious situations, some sticky situations, some situations that you never thought you were going to be in your life. Don't stop thinking. Fall back on your training. Always do what's good for the patient, but remember that this is not your emergency. People die. Okay? Remember that. Moving on. Allergies. We are always going to ask about allergies to medications. Always. Always, 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 always. We're going to ask the patient if they have any allergies to medications. We're going to start pulling up those medications. We might ask that patient again, right? We might say, do you have any allergies to specifically this medication? Okay? And then we're going to ask about allergies again before we give the medication. Okay, it's amazing how you can ask a patient 4 or 5 times if they have any allergies, right? And on that 4th or 5th time, oh, I forgot I had an allergy to that medication that you're about to give me. Oh, okay, sir, great. Thanks. I'm going to put this away now, right? And figure out what else we're going to do for you right now, okay? Always, always, always ask for allergies. Numerous times during your patient interaction, specifically before you guys are going to administer any type of drug. Make sure you guys are asking for allergies. Medication errors. Yep. Inappropriate use of medications could lead to patient harm. You kill them. Okay? You guys in the state of New Mexico at the EMT basic level, you guys have some really serious drugs you guys are giving people. Okay? Some drugs that other states, some of the paramedics are not allowed to give. Okay? And again, this is because we are so rural. All right? You guys are awesome. You guys are badasses. Okay? All your colleagues before you have proven that they know what they're doing. All right? Have gained the trust of all the intermediates and paramedics and nurses and mid-level providers and doctors in order for you guys to have these drugs at your disposal. Okay? You guys will make sure you guys know these drugs inside and out. You guys will know when and where to give these drugs and who to give these drugs to and who not to give these drugs to. Okay? Don't mess things up for your cohorts. Don't mess things up for your colleagues. All right? The EMT basic level here in the state of New Mexico is awesome. Okay? You guys are able to do a ton of stuff, and it's just expanding. All right? 5 years from now, this is going to be a completely different class. Okay? Please make sure that you guys stay on top of your skills. Please make sure that you guys are staying on top of your continuing education. And please make sure you guys know the drugs that you guys are giving to your patients. All right, let's continue the badassery of EMT basics in the state of New Mexico. Okay. We just want to make sure that we are very careful with our medications. We want to make sure that we're going through our 6 rights, the Dr. Pat's. We want to make sure that we're inspecting our medication, making sure that it's not expired, or making sure it's not all cloudy, right? The seal's intact, all that stuff, to make sure that we are not going to commit any type of medication error. The big thing is that if we do commit a medication error, and it has been done, I've done it. I'm not gonna lie, I've done it a couple times, but I've self-reported. Okay, I haven't beat around the bush. I haven't lied to try to save my ass. Nope, I have gone in front of my medical director, right? Not only for medication errors, but on numerous events. Bless me, medical director, for I have sinned. Here's my license, just in case you need to rip it up in front of my face and tell me I'm never going to practice medicine in the state of New Mexico again. I've done that, right? If you guys do create an error, if you guys do cause harm to your patient, please self-report it. Don't try to hide it. Don't try to bullshit your medical chart. Remember, that's a legal document. Okay? You lie on a legal document, technically you should go to jail, right? Don't do it, okay? If a medication error does occur, we need to notify medical control, okay? We need to notify the receiving doctor, right, that, hey, I messed up, okay? We need to follow our protocols in order to now help that patient, all right? We have caused harm because of a medication. Now we have to try to fix that while we're with the patient. We're not going to say, oh, shit, oh, well, I screwed up, I'm done, and watch this patient die or watch this patient go into a reaction, okay? We messed up. Our patient is now doing worse because of us, okay? Let's help our patient. Let's at least try to get them back to the level that they were at before we made the dumbass mistake of giving a wrong med or creating a medication error. At the very least. Okay, guys? Document it thoroughly, accurately, and truthfully. Do not lie on your patient care report. Okay? Do not lie on your patient care report. If you didn't do it, don't put that you did it. Okay? If you didn't do it, don't write it down that you did, okay? Don't lie on it, all right? And we need to talk, okay? Yep, you need to get your supervisor involved. We need to talk to the doc that's the receiving facility doc, okay? We need to talk to our partners. We need to talk to our medical director, okay? This is not a shaming, right? We are all type A personalities in EMS. The last thing we all want to do, apparently, is to admit that we made a mistake. I'm human. I'm flesh, blood, and bone, just like you. Okay? I have bad days. I have good days. Okay? It's okay. We need to create an environment. We need to create a culture where we talk. You need to talk about your mistakes. Right? People get very uncomfortable doing that. All right? But we need to talk about our mistakes. It's got to happen, guys. Okay? It's okay. If you self-report, yeah, you know what? If it's something really bad, you might lose your job. You might lose your license. Okay? But if we talk about it, we self-report, right? This could also be used as training opportunities for continuing education, right? For your whole department, right? Somebody else, because you did something stupid, you might have saved somebody else down the line from doing something stupid, because we are going to be trained on this, right? Your services are going to develop training on how not to create medication errors, right? It might change protocol. It might change standard operating procedures. You never know. It's all good. You're human. You're going to make mistakes. We get it, okay? Let's try not to do them so often. Okay, I just want to talk a little bit about intramuscular injections and subcutaneous injections. We are going to get some practice on this, a lot of practice on this during class. And at the end of the semester, you guys will be giving live intramuscular injections and sub-Q injections to each other during class. Okay? We'll talk about that more once we get there. The IM injection, this is injected to a muscle. It's very quick due to all the vasculature that's in the muscle. Usually it's anywhere between 5 and 15 minutes. I think that's pretty generous. I think the onset of action, to be honest with you, is right around 3 to 5 minutes. Medications that you guys give, epinephrine and naloxone. We've already talked about those two medications, so I'm going to keep it right there. I'm going to show you a couple more slides on how to actually do an intramuscular injection in the next couple slides here. Okay, so for our intramuscular injections, we usually use a 20 or 22 gauge inch-and-a-half length needle. I'll show you the different gauges in class. There are some pretty impressive size needles out there. And really, you can use any size needle, but we kind of try to be nice to our patients, right? So we're looking at a 20 or 22 gauge needle that's inch-and-a-half in length in order to reach the actual musculature of most of our patients. And we're going to inject this at a 90-degree angle into our patients for the intramuscular injection. So technically, an intramuscular injection can be injected into any muscle, okay? However, the state of New Mexico has recognized two spots at the EMT basic level where they would like you to perform this procedure. Those two spots are in the deltoid or the anterior lateral aspect of your thigh, right? So basically, right where your kind of hand falls on your thigh, right into that muscle is where you guys are approved to do a intramuscular injection site. When we're talking about subcutaneous injections, this is a drug that is injected into the fatty layer just beneath the skin. I agree with this onset. It's a little bit slower than the IM injection, right around 5 to maybe 10 minutes, depending on the actual perfusion, how much blood is going to that area where you're injecting that medication in. This medication does tend to last a little bit longer than the intramuscular because it's basically kind of stored in the fat in the body through perfusion. It needs to kind of break down that fat in order to get to the actual medication to begin with. We usually use a 25 gauge 5-inch needle. We're going to go in at a 45-degree angle, just underneath the skin into the fatty portion of the layers. The site usually on the back of the upper arm. Everyone kind of has that little fat pad back there, and that we can order to squeeze in order to get this into the fatty portion of the tissue. And then any time that we are working with a needle, we want to make sure that we do have a sharp shuttle. There's a picture of a sharp shuttle there. Any kind of sharps control. I'm going to teach you guys at the EMT basic level that you will never ever recap a needle. All right. Once we are done with that syringe, we're going to take that needle and place it directly in the sharps control container in order for nobody to get exposed or poked by accident to any kind of used needles. All right, guys, we are done with pharmacology. A ton of information, right? Again, I want to assure you guys that once we kind of start getting into the specific body systems and the disease pathologies found in that body system, such as the respiratory system, cardiovascular emergencies, neurovascular emergencies, endocrinology, right? Once we get into those certain sections, I will break down these medications again to you guys for that specific disease process, okay? For now, I want you guys just learning what are on these slides, okay? Make some flashcards, start forming some study groups with your buddies, okay? Start looking this stuff over, okay? Don't fall behind in your pharmacology. Okay, because I'll tell you right now, if you guys fall behind in this pharmacology, you guys will not be here at the end of the semester. Okay, Please make sure you guys are starting to study this. Make sure you guys print out this PowerPoint. It is in your Brightspace shell. You guys can make your flashcards, however you guys want to do it. Just please make sure that you guys are starting to study this information. If you guys have any questions, please do not hesitate to email me or set up an appointment through my office hours, whatever you guys need to do. I can go through this and help you out as best as I can. This is basically straight memorization, guys, okay? As far as dosages and stuff. What's not the memorization is when we actually start talking about the disease pathologies and when to actually give these drugs. And like I said, we will talk about those as we get into the specific disease pathologies themselves. Thanks for joining me. I know this was a long one, guys. This is one of the longer lectures you guys will have for sure. Very important stuff. Please email me if you have any questions. I'll see you next time. Thanks.